Yeah, welcome to ShineTech's YouTube channel. In this video, I'm going to go through medical anatomy MCQs on the upper limb. So the first question reads, regarding the clavicle, all are correct except regarding the clavicle, all of the following are correct except A, it is an example of the short bones. B, it is the first bone to ossify in the fetal life. C, it ossifies in membrane. D, it is the commonly fractured bone. And E, it has no medullary cavity. So the correct answer for question 1, it is A. So among all these, A is not correct because the clavicle is considered to be a long bone, not a short bone. So it is not an example of the short bone. So except A. Move on to question 2. Question 2 reads, the most common site of fracture of the clavicle is? The most common site of fracture of the clavicle is A, medial end, B, retro end, C, midpoint of the clavicle, and D, junction of the medial 2/3 and the retro third, and E, junction of the lateral 2/3 and the medial third. So the correct answer for question 2 is D. The common site for fracture of the clavicle is the junction of the medial 2/3 and the retro 1/3. That's the common site for fracture of the clavicle. So we move on to question 3. So question 3 reads, the inferior surface of the clavicle gives attachment of all of the following except A, conoid ligament, B, trapezoid ligament, C, costoclavicular ligament, and D, pectoris major muscle, E, subclavius muscle. So the correct answer for question 3 is D. Pectoris major does not attach on the inferior surface of the clavicle, but instead it attaches on the anterior surface of the clavicle. So when you look at this picture, this diagram here, you can see this is the pectoris major muscle. It attaches on the anterior surface of the clavicle, not on the inferior surface down there. So it is on the anterior surface of the clavicle and on the sternum. That's where the pectoris major muscle attaches. It is not on the inferior surface. So the correct answer is D, the pectoris major. The conoid ligament and the trapezoid ligament, these are ligaments which attaches the clavicle to the scapula. So these ligaments which are here, those are the conoid ligament and the trapezoid ligament there. So they attach on the inferior surface of the clavicle, and the subclavius muscle also attaches on the inferior surface of the clavicle, but except the pectoris major, which attaches on the anterior surface of the clavicle. The costoclavicular ligament, this is a name given collectively to conoid ligament and the trapezoid ligament. Together they are called costoclavicular ligament. So for question 3, except the pectoris major muscle which attaches on the anterior surface of the clavicle. So the correct answer is D. Move on to question 4. Question 4 reads, these muscles are attached to the medial 2/3 of the clavicle except. So all of these muscles here are attached on the medial 2/3. Medial 2/3 except. So A, sternemastoid, and B, the deltoid, C, pectoris major, D, subclavius, E, the stenohyoid muscle. So which one is not attached on the medial two-third of the clavicle? So the deltoid muscle do not attach on the medial two-third, but instead it attaches on the lateral three-third of the clavicle there. So this is the deltoid muscle, and it attaches on the retro, that is the retro side. So we have the medial line, and then all this part which is close to the medial side is called the medial three-third of the clavicle. But the deltoid is attaching on the retro three-third of the clavicle. So except deltoid. So the correct answer for question 4 is B. We move on to question 5. So question 5 reads, regarding the articulations of the clavicle, 1 is correct. Regarding the articulations of the clavicle, 1 is correct. So among all these choices, 1 is correct and the other choices are incorrect. So A, we have the medial end articulates with the manubrium by fibrous articulation. B, we have the medial end articulates with the manubrium by cartilaginous articulation. And we have C, the medial end articulates with the body of the sternum by the saddle-synovial joint. And D, we have the lateral end articulates with the acromion by fibrous articulation. And E, the lateral end articulates with the acromion by plain synovial articulation. So regarding the articulation of the clavicle, which one is correct? So the correct answer for question 5 is C. The medial end articulates with the body of the sternum by a saddle-synovial joint. Saddle-synovial joint is where we have one bone has a concave part, concave side, and the other one has a convex like surface. So when you look at the sternum, where the clavicle attaches to the sternum, we have the surface of the clavicle to have a concave surface, and the surface of the sternum to have a convex surface, making a saddle joint. So it is synovial because it has a synovial fluid and it is movable joint. Synovial joint are movable joints, are fully movable. So the joint is a saddle synovial joint, where we have the other surface to be concave and the other one to be convex, and forming the synovial, which is a movable joint. So the correct answer for question 5 is C. C is correct. So we move on to question 6. One of the following is not attached to the medial border of the scapula. One of the following is not attached to the medial border of the scapula. So which one is not attached to the medial border of the scapula? A, the levator scapula, and B, the teres minor, C, the serratus anterior, D, rhombodius minor, and we have E, the rhombodius major. So which one is not attached to the medial border of the scapula? So the answer for question 6 is B. Teres minor is not attached to the medial border of the scapula. So when you look at this diagram here, we have the medial border this side, and we have the lateral border and the upper border on top there. So when you look at muscle 62 is the teres minor muscle, the teres minor muscle. So it is attached on the greater tubercle of the humerus there, and inside these muscles it is attached to the lateral border of the scapula, not on the medial border. So that's why question 6 teres minor is not attached on the medial border of the scapula because it is attached to the retro border of the scapula. So the correct answer for question 6 is B. Move on to question 7. All of the following parts of the scapula can be felt except all of the following parts of the scapula can be felt except A, the acromion process, B, the crest of the spine, C, the upper border, D, the inferior angle, and E, we have the tip of the coracoid process. So which one cannot be felt? The one which cannot be felt is the upper border, because on the upper border, that's where the scapula lies. So that is the upper border of the scapula. So it cannot be felt because that's where the clavicle lies, and the medial side can be felt, and even the inferior angle, even the tip of the coracoid process. So the coracoid process is where the cracoclavicular ligament attaches. It is in the anterior surface of the scapula. It can be felt as well. And we also have the acromion process. This site can also be felt except for the upper border. The upper border cannot be felt because that's where the clavicle lies. So the correct answer is C, except the upper border. So question 8. The glenoid cavity articulates with the head of the humerus by A. The glenoid cavity articulates with the head of the humerus by A, fibrous articulation, B, cartilaginous articulation, C, plain synovial articulation, and D, ball and socket synovial articulation, and E, hinge synovial articulation. So the correct answer for question 8 is the ball and socket synovial articulation. As you can see in this diagram here, we have, this is the humerus, and on the head of the humerus there is a ball-like structure which is called a ball, and on the clavicle there it has a socket. So that's why we are saying it is a ball and socket synovial articulation. It is synovial because it is movable and it has a synovial fluid, and so the correct answer for question 8 is D. So the glenoid cavity articulates with the head of the humerus by the ball and socket synovial articulation. We move on to question 9. The surgical neck of the humerus is related to the A, the radial nerve, B, the axillary nerve, C, the ulnar nerve, D, the medial nerve, and E, none of the above. So question 9, the correct answer is B. It is related to the axillary nerve. The surgical neck of the humerus is related to the correct answer is B, the axillary nerve. So as you can look in this diagram, you have, this is the humerus, and the surgical neck is somewhere there. So on the surgical neck, you would see the axillary nerve passing there. So that's where the axillary nerve is passing. So this axillary nerve is related to the surgical neck of the humerus, somewhere there. And we have the radial nerve. The radial nerve is far from the surgical neck there. So the correct answer is the axillary nerve. So we move on to question 10. The back of the medial epicondyle is related to the back of the medial epicondyle is related to A, the radial nerve, and B, the axillary nerve, C, the ulnar nerve, and D, the medial nerve, and E, we have none of the above. So which one of these is related to the medial epicondyle? So to get this question correct, we need to know what the medial epicondyle is. So the medial epicondyle is simply the part of the humerus. This part of the humerus here, these are what we call the epicondyle. So the part of the epicondyle is related to the ulnar nerve. You can see the ulnar nerve passes near the epicondyle. All these other nerves are passing on the middle of the bone, but the medial side of the medial epicondyle is related to the ulnar nerve. That's the nerve which is passing near the medial epicondyle. The retroepicondyle is this side, and the medial epicondyle is this side. So it is the ulnar nerve. So the correct answer for question 10 is C. The ulnar nerve is related to the medial epicondyle. So thank you very much for watching. Don't forget to like if at all you like my video, and subscribe so that you don't miss any of my videos. Hit that bell, the notification bell, and leave your comment in the comment section below concerning this video.